Okay, thank you. Thank you very much for your patience. I'm sorry. Yeah, I'd like to present some interesting cases and complications. The first patient is 51 years old, male. He had atrial thrombus in the transthoracic echocardiogram, and he admitted to cardiology service. He had a left hemispheric stroke at 12 o'clock, and NHI score is over around 24, and CT angiogram revealed left common carotid occlusion in this patient. And in this patient, what we have used SIM2 diagnostic catheter, Neuron Max sheath, and we also use aspiration pump in this patient because, as you will see, there was a huge thrombus at the common current artery. This is engagement of the left carotid artery with SIM as usual, and after that we introduce Neuron Max aspiration catheter. This is the Neuron Max catheter. You see how much thrombus we have here, and in this normally we use edge catheter for aspiration, but in this case we had used directly Neuron Max catheter, which is sheath, and we aspirate through that sheath. You see that now Neuron Max in the thrombus place, and we aspirate. And after aspiration of the common carotid artery, we just give contrast, and we see that there is also occlusion of the middle cerebral artery. You see after this point, the artery is occlusion, and also anterocerebral artery is occluded in this patient. And under roadmap, we just insert our wire as usual. You have seen many times today, and also we inserted our macrocatheter as well as edge catheter. This is aspiration catheter. We insert this by crossing the thrombus, as Adnan Siddiqui suggested us, and then we use here thrombus aspiration catheter as well as stent lever, both. And after aspiration and embolectomy, we had a nice result actually, but we have also occluded anterocerebral artery, as you see here. So I think we have to do something about this as well, and we sent our system to anterocerebral artery. This is the stent lever system, and we wait a couple of minutes, 2-3 minutes sometimes, and after retrieval of the solitaire, you see we have also flow through to anterocerebral artery, and we have some spasm here. And from the left system, left view, we also see middle cerebral artery branches are okay. And another case is 60 years old male. He has 3 hours symptoms onset, and aspect score was 9, and NHA score is 20. He had previous MI and diabetes. And this patient, you see that there is a middle cerebral artery occlusion. And as usual, we did this patient, we just wire it and send a microcatheter and send a stent lever system. And you see we open this is Trello system, and we open as self opening system. We just remove the microcatheter and we open the stent here, and we wait some time, and after remove the Trello system, after 3 passes, we have seen this, so it's failed. And after and then we did contrast injection after Trello was retrieved, and we feel that there is a stenosis here. And we, in this patient, after 3 passes, we implanted coronary stent, 2.5 to 1 to 2 millimeter. And you see, this is the stent. Of course, we have to inflate it very gently. We use maximum 6 to 8 atmosphere. And I think 2.5 millimeter is okay at this level. And this is after stenting. So there are some, of course, paper regarding coronary stent implantation in the cerebral arteries. I'd like to present another case, which is 50 years old male. He is a current smoker and hypercholesterolemia. He also presented acute onset of right-sided weakness and dysarthry. NHS score was above 20. MRI shows impaired diffusion at left MCA area. And in this patient, there was a tandem occlusion, but this is a sclerotic one. We have a very disease internal carotid artery. In this patient, what we did, we used MoMA here, and you see the MoMA. And after that, we insert 014 wire, and we did pre-dilatation by 3 by 20 millimeter balloon. And after that, we did another dilatation by 5 millimeter balloon. And of course, we did aspiration during this, after this procedure, and we have lots of material, as you see here. And then we just checked the distal part, and we saw kind of T occlusion here. And in here we send stent reverse system. This is Eric, and we have some thrombus, and this is after thrombectomy. And this patient, we had stenting after 10 days, not the index procedure. Another patient is 50 years old male. He had left paralysis and confusion. NHS score was 13. And this is posterior cerebral circulation disease. We have acute occlusion of basilar artery. And in this patient, as a routine we sent a revive system, the first posterior cerebral artery, and then after that we couldn't have a nice flow, and then we send. You see that we have some thrombus in the left posterior artery as well, and we send another microcatheter and wire, and after that we wait a couple of minutes, and after removing the stent remover, we have nice image of posterior cerebral artery. So this system also works for posterior cerebral circulation. And this is the imaging after implantation. And in this patient, we had vertebral artery stenosis. You see, and we had treat this not the same sensation, but after 2 weeks. And this is last presentation, last case, 63 years old male, right-sided paralysis. And we had here, again, middle cerebral artery occlusion. We sent a wire and a device, as we do usual, and we had something. This is Eric stent remover again. This is the device. And after embolectomy, this stuff flow is not good, but after that, what we have seen is, please look at carefully, we have a small perforation here. We have to be very careful about perforation. Cerebral artery is very, has thin wall, not the like coronary artery, and they are in the fluid almost. So we have small perforation, and this patient had to go to surgery because of that. And from the lateral view, we have still some occlusion here, but of course we stopped the procedure at that point. I had a case from my colleague. He's not my case actually, and done by another center. And in this patient, they do after several embolectomy attention, they do ballooning, angioplasty, and I think it's a huge balloon for this. I think it's around to me 3 or maybe 3.5, maybe 3.5. Then after that, they see that there is a clot there, and they couldn't remove anything. They see that there is a clot, and they think that it's better to put a stent in this level. You see the huge thrombus, and they put a stent. After stent, they give some contrast, and they find out this. It's a perforation. But luckily enough, they do, as a coronary, they do balloon dilatation here sometime, I don't know how, and after that, they have this image. So I don't know how often this, but it seems that the perforation sealed completely. Thank you very much for your attention. Sorry, I'd like to invite you to our peripheral meeting, which will be held in Cappadocia in February. We will have one-day acute stroke workshop there, organized by Özcan Özdemir, Atilla Özcan Özdemir. We'd like to have you in Turkey. Please come. Thank you.